Clark-Cowlitz Fire Rescue covers 125 square miles and serves 45,000 people. Much of the district is on the rural side, but the population is growing and the call volume rising.
3,100 emergency incidents in 2016. We had 5,000 last year. That's a 57% increase. We saw a 17.6% increase in just 2020 to 2021.
Fire Chief John Knorr says these are drastic increases and paired with current resources have led to a lag in their response times. CCFR staffs its engines with 2 people, whereas other departments have 3. And he says only 50% of the time a trained paramedic is on board.
When we have a critical call like that, we have to call one of our other units that may have a paramedic on that day to come over and assist. And at that point, we're now on scene waiting for an ambulance.
Chief Knorr claims their response time problem is further aggravated by long response times of the private ambulance provider for the area, AMR.
So we could stabilize a patient, but if we don't have an ambulance to take them to the hospital in a timely manner, we're missing out on that quick time for the treatment they need in an emergency room. The number of times that AMR is over 20 minutes in their responses continues to increase. It's up about 109% over 2 years.
We just learned tonight there was a call where a gentleman was having, what came to find out is a heart attack. There was an incident where it took 50 minutes that they were waiting for a response time from the private ambulance company.
Information like this compelled Stan Chun and the other fire commissioners to place an EMS levy on the August primary election ballot.
This levy will allow us to provide safety in our community for years to come.
If approved by voters, it would cost the average homeowner $21 a month, and the revenue from it would address the shortcomings. Fire Rescue could hire more emergency response workers and staff its own ambulance to transport critical patients if AMR can't make it to a scene in time.
And a 20-minute response time when you're having, a cardiac event, a seizure, or an anaphylactic reaction is a long time to begin with. We're putting it out there to the voters. Do they want this level of care at home?
We reached out to AMR about these claims. A spokesperson for the company issued this statement. American Medical Response Clark County has complied with the response times designated in our contract since its start in January 2015. We have seen an increase in call volume, but have added additional resources to maintain compliance with our contract requirements. David?
Thank you, Alma. And as Alma mentioned, that levy will be on the ballot August 2nd. If you're